Good morning. Thank you for joining the Nashoba Valley Chamber on Chamber Chat. I am here with Steve Roach. And Steve, you have a lot of titles in your name. Tell us where you are right now.
Well, today I'm actually at HealthAlliance-Clinton Hospital in Leominster. I'm the interim CEO here. On top of that, I'm the CEO at Marlborough Hospital in Marlborough. So I run multiple facilities for UMass right now.
We've had the pleasure of working with you and knowing you for, I don't even know how many years, many years. You might remember better, but you were the CEO of Nashoba Valley Medical Center. You served on the Chamber's Board of Directors for a number of years. And so we've had great working relationship with you. And so I was so excited when I heard that you were coming to Leominster, Clinton, to UMass Leominster Clinton, and I knew that they were turning it over into great hands. So,
oops, sorry, let me turn that off. Sorry, too many noises in the background, a lot of things going on. No, it's been 17 years in the market. With the chamber since 2003 at Nashoba. Through 2013, which was great, and then I've been 7 years with UMass. But I still live in the market, live in Littleton, and I'm on the board at Main Street Bank. So I'm definitely actively involved in the communities.
Absolutely. So tell us a little bit about what has been going on at the hospital with this pandemic. You guys have been very busy. It's been a huge change. But you guys are open for business.
Yeah, it's a little different, as far as busy, we've been very busy administratively, and we've been relatively busy on the inpatient side related to the outbreak of COVID-19. However, for the last 89 days as of today, we have basically been short volumed. We basically closed a lot of our departments. Mainly so that we could reallocate that staff to care for the COVID patients in the hospital to make sure we had a safe environment. In addition, the state had basically shut down all elective surgeries, elective cases, elective anything. Over the last 2 weeks, we've actually been ramping that back up. We're not back up to full services. However, we are seeing any patients who've put off or delayed their care, where that delay may result in additional impact on their care and outcomes. We don't want people to be in pain, and that's not appropriate. And we don't want people to have their disease or their health issue create more stress and impact on their life. And the rules allow us to see those patients right now. Hopefully, phase 2, we'll be able to expand into the full complement. But right now, we're pretty much doing everything except for screening mammographies. And we're not doing any inpatient surgical cases right now, mainly because we do not want to have additional impacts on our inpatient capacity with the COVID crisis still going on in the state. So, we're trying to ramp it up as fast as possible. We know there's a need in the markets for people to get care, and we want to be able to service that.
Nice. And how are your team members doing through all this?
Surprisingly, well, I think, initially, everybody was scared, and we've gotten kind of ourselves to the new normal for healthcare. Initially we did not have enough PPE throughout the state, to ensure we had a steady state. We were lucky in the hospitals. We had enough, but it was not a plentiful supply. But now that we've been able to ramp those up, people feel more confident in it. We're ensuring it's out there. However, there is an increase in competition for those supplies. Now that most other businesses are starting back up, we're seeing the competition to get surgical masks and other types of masks go up as other people are starting to purchase them. So it does create some challenges, but people here have kind of settled into the new normal, and now they're kind of, at a point where we're a little bit on the worried side of whether or not we're going to be able to get our volumes back up to normal. Because if we aren't, then it's going to become an economic issue for hospitals and it's already an economic issue. Yeah, I think we, as a system, we've lost about $70 million in 2 months, and that doesn't include the month of May. So we'll see how that goes. But you know, going forward, we need to get our volumes back to normal, so that we can ensure we can employ everybody going forward.
What message could we help spread to the community to help that?
I think the most important piece is a lot of fear in the market. There's a lot of concern for people about exposures and getting sick. I look at it a little different in the hospital. We have been extremely vigilant about cleaning, extremely vigilant about spacing of people, how we get people in. I actually, honestly, my personal opinion, like this is probably the best time to go get healthcare. One, we're not extremely busy, and we have a lot of people focused directly on the infection control processes, ensuring a really, really safe environment for people who arrive here. And I think it's a good thing that way, but I think we have to continue that. The new normal, what we come out of is how are we going to get people through? We used to have these things called waiting rooms. Well, what is that going to be? You know, are we going to have those people who are going into the procedure next in the waiting room and the people behind them in their car, like restaurants with those little light up buzzers? So we're going through a lot of iterations to determine how we're going to do that. And some of this is going to be through trial and error over the next couple of months to make sure that we have an efficient process that makes sense for people.
So we also need to be patient as businesses like yours are transitioning through whatever the next phase is.
Yeah, I think everybody has to be patient. You know, you see all the stuff online. Unfortunately, they're called the Karens, and the people who are freaking out over not wearing masks or wearing masks. And honestly, it's not, you know, there are some people who do have health issues who can't wear a mask, and we have to be accepting of that. But for the 99.5% of the population, it's really not that big of a deal to wear one when you go into a public space for a few days, you know, off and on for the next couple of months. Right. I think it's what's safe, and we need to be thinking about how we do that. And that will help us get back to the normalcy. Yeah. You know, clearly it's a challenge on a bunch of the other businesses, especially restaurants, bars. It's kind of hard to eat with a mask on, and how are they going to do that? And you know, I balance it with business and the healthcare side. As much as, you know, we need to make sure we're protecting everybody, at the same time, we do need to get businesses back up, because that unknown is creating behavioral health issues and additional stress on not just those business owners, but everybody who's isolating. It's not normal for humans to isolate for this amount of time. So people are starting to get a little stir crazy, to say the least. And we, you know, as long as they're going out and being safe, and this is just my personal view, it's not anybody else's view, I think you have to have some balance to it. People do need to get out a little bit. Clearly, we do want them socially isolating with the distancing and wearing masks, but we just need to be careful.
Yep, absolutely. And you've had a lot of local support from the community, from the businesses. I've noticed a lot of organizations and people bringing you PPP, bringing you lunch, things like that. How awesome is that to have that support?
Oh, it's unbelievable. You know, we've kind of termed it the COVID-19, the weight gain, like the freshman 15. It's been great. Administrators don't need it, but the frontline staff really does appreciate the food, the donations, the gifts that they've been getting. It's kind of morphed a little bit, which is actually good and interesting. Now that it's gone a little bit from food, now we're getting skincare products, which is kind of nice. It's a nice thing for the staff to get, and they appreciate that. I think it's been a huge outpouring support from the local communities. And certainly we probably couldn't have got through this as much or as well as we have without that support. So it's been fantastic.
Awesome. Aside from COVID-19, what the hospital in the past year has had a lot of renovations. Tell us what's been going on and what plans aside, and I know that this throws a big wrench in everything, but what are your plans otherwise?
Well, We had lots of plans. The challenge is what are those plans going to be adjusted to
Right.
in the new economy? And you have to take it in perspective. The healthcare industry between March and July, just in Massachusetts, is going to lose a combined over $5 billion. I know everybody hears about the Major League Baseball potentially losing $4 billion,
Right.
but in 4 months, hospitals are going to lose $5 billion. So it's a bigger number, and that will really impact our capital ability. First and foremost, our focus right now is getting back our volumes and getting back to normalcy on that. And then we'll have to reassess what our capital picture looks like after the markets stabilize and what the cash status is. We do have a large project that's actually coming to a close. We just rebuilt a brand new ER at Health Alliance in Leominster. That project is about a $45 million project all in. And it was going to be fully complete by end of June, but we did shut the project down for about a month or so, a month and a half during COVID because of the safety issues of bringing people from the outside into an ER. Yeah. So that has just restarted last week, and we're probably pushed out a month or so, but it would be great to get that space done. I know the staff down there and the patients who've been here have been under a lot of stress and a lot of movement and a lot of crazy construction stuff while they're doing their jobs. But it'll be great. It'll be a great product for the community to have that in. And it brings everything up to date with the new standards around behavioral health and suicide watches. So looking forward to it.
That's awesome. That's great. Anything that we didn't cover that you want to share with the community?
Not offhand. I think the most important piece just to get out to people is, and this is just something I feel it's important. Over the last 2-3 months, people have been at home. And for those who still have an income, haven't spent a lot of money on food and going out and local business. I do think it's important as soon as we do get some more opening that we make that investment in our local businesses and local stores. Aside from those retailers like Walmart and Amazon who are getting all the online business, we really need to inject money in the short term into our local communities. I think it'll go a long way, and it's kind of the pay it forward program. If we're doing it locally, then those people in the local market will then use that money to continue purchasing local services, either restaurants, hospitals, anything. So I think it's important that people focus on that, especially as we get into phase 2 around June 8th. So.
Absolutely. Well said. I echo those comments.
Yeah, it's important.
Yeah, and we have a lot of great businesses. I have not yet heard of any business that has plans to close, but there's the uncertainty for some businesses, and it's hit a lot of businesses really hard. So we do need to do what we can.
Well, certainly the PPP loans have helped, but based on some of the information, they're not very easy to go through the forgiveness application. So, clearly people should reach out to their accountants to figure that out, because it's a lot of detail, and if you get it wrong, it could create some issues for the businesses. Yeah. And certainly we don't want any local businesses going out of business, and we really want to make sure we can get people back to employment.
Yeah, absolutely. Well said. Well, thank you, Steve, for joining us, and thank you to folks for joining us and listening, and I hope everyone has a wonderful day and continues to stay healthy.
Great. Thank you, Melissa.
Thank you.